Before moving on to the session, it is indeed a privilege to invite a distinguished academician and thought leader in healthcare quality and leadership, Dr. David Greenfield, Professor of Health Leadership and Management at the University of New South Wales, Australia. Dr. Greenfield is a globally respected expert whose work in health systems, quality improvement, and implementation science has significantly influenced healthcare delivery across settings. His research emphasizes how simple, well-designed studies can lead to meaningful and scalable improvements in patient care. Today, he'll be delivering the keynote address on the thought-provoking topic, when simple research delivers a big impact. With great honor and anticipation, I invite Dr. David Greenfield to take the stage and share his valuable insights with us. Welcome you, sir.
I'm happy with that. Good morning, and thank you for inviting me here today. It's a pleasure to be with you here in Chennai and at your CAHOCON conference, and it's a pleasure to be able to talk to you about the importance of research. As introduced, I work at the University of New South Wales. I do research and teaching into health system safety and quality, and I teach into a Master of Health Leadership and Management program. And one of the core courses I've been teaching has been called Evidence-Informed Decision Making, which is about helping clinicians, managers, healthcare professionals find, use and apply evidence to improve services, improve patient outcomes and improve the efficiency of services. I'm also very proud to be a member of ISQA, part of their academy, and have been attending their conferences and part of their work for many years, and have a history in doing accreditation research. This is a picture of the first ICU that was set up in the US in 1955. I'd like you to take a quick look and a bit of a detailed look at that and just think, what do you see there? What can you see? The equipment, the people, what touch is occurring, what trust is going on in that diagram. If we fast forward to what a modern ICU looks like. This is a picture from 2026. What do you see in that picture? What's similar and what's different? What's changed over all those years and what's remained the same? In looking at that picture, what are the things that you take for granted or see there but we no longer think about? For me, it's looking at that picture and seeing and thinking, for those two professionals to be there at that point in time and delivering care, someone's had to roster them on and have them there present in that space. Someone's checked their credentials, someone's trained them, someone's qualified them, someone's supervised them so that they're able to work. Other people have organised the PPE equipment. It's been ordered, it's been identified as appropriate, fit for purpose, it's been stored somewhere in a room, they've been able to go and access it, get ready, do their own infection control procedures. Clearly they're doing some sort of teamwork and interaction with one another and working effectively together. So again, there's a level of training and supervision and support that's gone on to make that efficient and make it work. If you look at the photo there, you can also then see a whole range of technology that's sitting in that diagram. for that technology to be there. Someone has looked at that, someone's developed the technology, someone's marketed it, someone in the organisation has said that this is appropriate, we can use this. They've had to train staff, they've had to make sure that it's continually monitored and fit for purpose, it's operating within its set parameters. And across the picture there, you can see there's another bed and then another one behind them as well. So that there's multiple patients being cared for at the same time, which implies multiple staff, multiple coordination, and multiple families, multiple patients, extended people involved in all of that. For us to have gone from where we were a little over 50, 60, 70 years ago to where we are now has been a whole range of quality improvement, process improvement, evaluation and research projects that have occurred to help us understand how to improve, identify, monitor, evaluate and drive healthcare to be efficient and different to as it has been. If, like me, you're over 50 and even over 60, you will have seen these changes across healthcare in your lifetime. How it went from being a fairly simple, unstandardised, unorganised process to one that's highly regulated, highly systemised and highly efficient. And as much as our two speakers immediately before us were talking about, it's both a business, it's a service industry and it's a health industry, and it's the complexity of that. So when I think about research, it's how do we undertake and do things so that we can deliver this sort of care, provided in a very efficient, effective and safe manner. So I think about research and I think, what's the goals of research? What are we trying to do? And for me, it comes down to three very simple things. Simple, but not so simple. Firstly, how do we improve people's lives? How do we make it more sustainable and reliable? And then if we're doing research, whether it's a quality improvement project to a longitudinal study, how do we inspire others? How do we help and inspire and nurture the next generation to come through and develop and to be better than we are now into the future? In the same way as with your conference here with CAHO, I don't know, while they may have had a vision 10 years ago to say, this is where we hope to be, what we would really like to be, could you have ever envisaged it from where you started 10 years ago to where you are today? So any sort of research, any sort of quality improvement, evaluation work is about doing these three things. In trying to achieve those three goals, I see that what effective high quality research has these dimensions to it, which is for me encaptured by the sextuple aim. So does it improve individual patient care experience and outcomes? Does it address the population health issues? So that you look at the whole population of patients with the similar sort of issues? Are we effectively using resources? It's a business healthcare. We can only keep doing things tomorrow and next week and next month if we run it efficiently and effectively. Thirdly, I'd say, and this isn't something I've heard talked a lot about through the last couple of days, are we looking about the health workforce's well-being? How do we nurture, develop, support our staff, support the health workers across all parts of the service, from those on the front desk, to the ambulance drivers, to the cleaning staff, to all the wonderful clinicians in your services? How are we looking after and developing those people? Fifthly, health equity. How do we look at the whole community and provide care and allow all members of the community, regardless of financial status, religious status, where people live, but so that they get care and that's efficient and effective for everybody? And finally, how do we do it so that it's delivered in a resilient and sustainable way, so that what we're doing today can continue tomorrow and in the next year or two from there? So research with impact, for me, addresses these sort of components. It looks at systems, it looks at the organisational, the interpersonal, the interactional, the clinical issues that are there. It looks at both technology and knowledge. How do these two things fit together? How do we link and share people's experience, teamwork, with the technologies that we've got so that it's effective and efficient? And finally, it needs to be rigorous, sustainable and translatable. That high quality research, whether it's a quality improvement project, an evaluation project, or a longitudinal or clinical type study, needs to be rigorous, ethical over time. So, how to do impactful research? Engage with a broad group of stakeholders. Some of the talks I've seen here in the last couple of days, that's the thing that struck me, is that when people are engaging with broad coalitions and identifying a problem that matters across teams, aligns with organisational strategy, aligns with your state and national strategies, then you've got a chance for it to be impactful. How does the research fill a gap in knowledge? Is it rigorous, sustainable, scalable? Is it going to be useful for other people? The three questions I put to any of my colleagues and any of our PhD students when we're developing work is, how does it contribute to the knowledge base? How does it challenge the knowledge base? Or how does it confirm what we already know? So that it helps people think and improve what they're doing. Impactful research has a strategy to share knowledge, to share the lessons, both with the teams and the organisations from which it's come, but also to a wider population. So coming to events like this, talking to your colleagues, talking to other organisations, come to the ISQA conference, share your knowledge, share your experience, share the expertise that you have. It's been clear about your audience so that you're dealing with both academically and industry and sharing your knowledge and experience across that. It's having a perspective of the time frame of what's appropriate to do, when to do it, how to use it, how to use the resources efficiently and ethically. And finally, again, an issue that was touched upon by our last speakers is, how do you develop a culture of impact so that any work you do isn't just a one-off, but it is developing that next generation, developing your junior members of staff, it's helping educate and train and drive people forward. If you're doing this, then I think you're developing impactful research that will stand the test over time. Thank you for inviting me here today. It's been a pleasure to meet with you. If you would have heard, in terms of ISQA, being very proud to be collaborating with you and partners with you in this. I would encourage you to think about the ISQA conference, which is on later in the year in September in Dublin this year, to bring the knowledge, the skills, the expertise that you have as an organisation across your extraordinary healthcare system and share it with the rest of the world. You have as much to teach the rest of the world as this conference as potentially that you would take away from it. Many of you know about the education programs that ISQA offer. Have a look at those as well. There's a whole range of reasons to get involved. I'm also a deputy editor of the Journal for International Quality in Healthcare that ISQA runs. If you'd like to talk to me more about that, then I'd love to talk with you about that as well. Thank you for your time.
Thank you, sir. Thank you so much for that thought-provoking research enlightenment. Can you please take your seat down the panelists? Let's move on to the panel discussion. So it's my privilege to introduce our esteemed moderators for the discussion. We have with us Dr. Pratheesh Ravindran, Professor of Neurosurgery and Deputy Medical Superintendent at Mahatma Gandhi Medical College and Research Institute, a clinician, academician dedicated to advancing impactful research. Welcome you, sir, on the stage. May I also take the honor to invite a panelist for the session. We have with us Dr. Shah Chinmay Jayprakash, Professor and Head of Department at Government Medical College, Bhavnagar. Dr. Satish Chandra, Director, Medical Ethics and Research Department, Lab Medicine, College of Medicine, Johns Hopkins Medical, USA. Dr. Rahul Deshmukh, Group Director, Quality, Sulega Health Group, UAE. Dr. Shyam Kumar N. Keshava, Professor and Head Department of Interventional Radiology, Head Division of Clinical Radiology, CMC Vellore. Dr. Ketan Aswale, Medical Advisor, Internal Medicine, Pfizer India. With such distinguished experts leading this dialogue, this session promises to inspire us to think beyond publication and focus on research that truly matters. Over to the moderator. Thank you.
Good morning, everyone. I hope we have a fruitful session here. I welcome all the panelists, especially Dr. David. We will just start with the discussion, and I'll be just asking some targeted questions to the individual panelists, and you can give your insights in that. So my first question is to Dr. Satish Chandra. Sir is our editor-in-chief of our journal, the International Journal for Healthcare Quality, Patient-Centeredness and Safety. Sir, could you just tell us about the journey of this journal since its inception, and what are the challenges you've been facing, and what lies ahead? So how do we plan to go forward with that?
Good morning to all the panelists. Thank you, Dr. Pratheesh, for that question. As far as the journey is concerned, it's an amazing journey. I have taken over the lead of the journal in the last 18 months or so. It's an amazing experience, especially being in India and trying to, thank you very much. For our experience has been fantastic. And CAHO, when the giant supports you, I think the process becomes easy, the practice becomes easy. So that has been my experience. Now, in terms of what are the challenges that I come across, I think the challenges that I have is nothing unusual for any other editors or any other journals that are in the space. First and foremost, I have to be very honest here. One of the biggest challenges I face is that to tell the guys out there that this is your journal, this is our journal, we are ready to handhold you, we're ready to work with you. Please come forward and think on your research caps and let's get to publish and then show to the world that we can do it. Okay, and that message doesn't percolate down south as quickly, as rapidly as we expect. That is one of the highlights that I would like to share. And in terms of the ecosystem for the International Journal of Healthcare Quality Patient Safety, what I have noticed, because there are about 972 journals that are in the space, including some on policy, the others on health services research. About 280 of those journals have varied topics, and research is one of the components of those topics. Okay. Whereas there are 50 of them are in the Q1 space. So as far as our journal is concerned, the journal that you see in the backdrop here has a research component, a technology component. There is your voice. So you can voice your opinion. Okay, there is an opinion section in the journal which actually promotes if you have a thought, if you have an innovation idea, that can be submitted to the journal, it will be reviewed, and it can be that can be published, and you can reach a wider world here. So those are the two major challenges given the space that we are in. But the good thing is that, as far as India is concerned, we have a huge volume and the world. And I think it's just about after the initial phases, we might be able to take it to a higher ground. That's the first thing, and we are very optimistic about it. The next thing is, for those of you wondering, what are the other challenges that we would face? I think, like I said initially, all the challenges are very, very similar to what other editors face, because there are a number of publications now, many publications that are in the space, and that and now journals have to go back and compete for good articles, and that is nothing unusual, and we face the same thing. And in terms of the technical part of the journal, I think we have one of our challenges was to create a very robust review system, which we did. A very robust system. We have at minimum of 2 reviewers who actually score your papers. The second thing is to have that your submissions are much more user-friendly, and the papers we acknowledge your submission, and we give you a turnaround time that is in tune with the international standards of acceptance or rejection. So these are some of the challenges that we have faced. But more importantly, like I said, I think this concept has to sink in that it is your journal, it's my journal, it's our journal. And we need to make sure that unless we work hard, we will not be able to make this journal and our studies and our research visible to the wider world. and creating a wider visibility in the global arena is something that we were looking forward to. Thank you very much.
Thank you. Thank you so much, Dr. Satish. My next question is to Dr. Shah. Sir, your team had recently published quite a significant article on the reuse of single-use devices in interventional radiology, and these led to the national guidelines. So my question to you is that how was the entire process of, why did you choose this topic? How was the study envisioned? And how was your experience during this entire process of the study? And what are the challenges you see towards implementation of these? Once you created the guidelines, what do you see about challenges do you see about implementation? And how can we replicate this, something which has happened in interventional radiology and the National Society? What about the other organizations, the other societies and other specialties? So what would be your take on that?
Thank you, Dr. Pratheesh. You asked about 10 questions to me, but all fall into the same category. I must say that whenever we publish something, it should be useful to the readers. So when we say it's useful to users, we should have an idea before publishing. Secondly, after publication, it is assessed by the number of citations. So more citations you have, more valuabilities. If you see this cycle which has been displayed here, it looks like a life cycle of a parasite. So if you see on your right side, there are two yellow rectangular boxes. So that is a single-use device. So many devices, what we use, they are supposed to be used for single time. Some of them go inside the patient body and they remain there. But we take a lot of items to deliver it inside the body. But they are supposed to be thrown out. But in reality, many of these single-use devices, which are outside the patient's body, they are cleaned, they are packed, they are assessed for quality, and then it is used for some other patient. So it is a universally done practice. However, we saw there is a lack of guidelines for that. There is a lack of guideline. So when we are doing something like this, we need to have some framed guidelines. That's what we thought. So this was a suggestion from the members of Interventional Radiology Society. And at the same time, what happened incidentally in Christian Medical College, we had a meeting with Dr. Lallu Joseph. So she was asking us, do you have any guidelines? So then we made a committee. So when we made a committee, we had people from various representation, and we had a commitment from them. We are going to discuss very seriously for a month's time, and these are all the things what we have to do. At the end of 1 month, we'll have a first draft, and then we'll internally review. For example, I'm in charge of finding out which are all the countries who have got guidelines. So I'll gather that opinion, and that will be assessed by Dr. Pratheesh Nair before we send it to the journal. So we had several discussions like this, and then we sent it to a journal. So this cycle shows how we moved forwards, and certain guidelines. And from the guidelines, as you come lower down, you can see a green rectangular box. So that tells about the regulation. How do we regulate it? Then as we ascend, you can see the light blue color. So that shows the strength that you should go towards a research, publication, and then we go back to the single use. So ultimately, if you see the top portion, top rectangular box, it says the feedback to the manufacturer. For example, if I'm using a device which indicates a battery operated system to detach a coil, so that battery operated device should have something like how much battery is remaining. So this is the type of feedback what we would like to give to the manufacturer. So if you see this table, there are about 5 or 6 stakeholders. And we want to highlight this, and we want to give the individual responsibility to all. And our focus is patient. Patient is the important person, keeping the safety in mind, quality in mind. But at the same time, we want to be economical. We also want to be good for the environment. So this is how we made the publication possible. And we are very fortunate that we got it in a good journal. And this is one of the first publications from India. So the work remaining for us, if I can continue, is the spread what we have is a vertical spread. what we are doing in the given department, like intervention radiology. But I see about 15 other departments who are using the single-use device. From the audience, can I ask you to raise your hands? How many of you reuse a single-use device in your hospital? Can you raise your hands? Okay, I can see about 35 hands. I'm sure this is indeed important for all of us, and we can be safe for the patient and also safe from medical legal aspect. Thank you.
Thank you so much, sir. Coming to Dr. Rahul. So, Dr. Rahul, you are part of the team which was involved in a landmark study from CAHO, which got published in BNG Open Quality on patient-reported experience measures. So, my question to you is that what were the lessons that we learned from this particular study? What are the, also please tell us your experience while this entire, it was a long study, quite a rigorous process. And what are the lessons in it for like co-production and patient involvement in healthcare safety and quality?
Thank you for that question, and thanks to the organizers for giving us this opportunity to talk about something that is really important. Research, particularly coming from this part of the world, looking at the population is going to be critical. Regarding the PREMS study as such, as you were rightly saying, this was a landmark study for all of us. Because for two things. One, patient-reported experience measures have been in place for some time. Usually they were used more for experience as such. What is the quality of our food, or how are our parking facilities? It was never looked at it from patient safety point of view. So that was one major change that happened. We started looking at PREMS from a patient safety point of view than looking at it from just systems point of view. We were concentrating on individual patient now. Obviously, the broad outlook was still for patient safety and for systems, but we went to the micro level. That was one thing. Second, patient-centeredness again has been used for quite some time. Patient need to be partner in care. Again, that was more at micro level, each patient we were talking about. With this project, what we have done is we have gone a step further, wherein the tools that have been developed have been co-produced with patients. So patients in this particular study were treated as experts, because these are patient-reported experience measures, so eventual end users are patients. So that's why it was a combination of clinicians, doctors, nurses, quality managers, and equal representation for the patients. So that's how it was both. We were trying to achieve both targets at the same time, repurpose PREMS as well as make sure that it is the patients who are having their they have their say in designing these tools. I would say it has been a grand success. So far, those PREMS tools, we developed 17 tools. They have been translated into 13 languages. And from CAHO website, the latest count is somewhere around 6,000 times those tools have been downloaded. So various hospitals have been using these tools on various occasions. I think that's where the patient-reported experience measures have proven to be a game changer. And there is still a long way to go for us. But yeah, that was a very enriching experience for all of us. Thank you.
Thanks a lot, Dr. Rahul. Over to you now, Dr. Ketan. You were involved in a project which this was a collaboration with Pfizer and with CAHO with regards to in cancer patients regarding thrombosis. So when we look at this particular collaboration, could you brief us about how the study went and what were the results that we found? And also, how could this particular be kind of a beacon or a guide for other industry academia collaborations which could do in the future?
Thank you, Dr. Pratheesh, for this question. And at the outset, I would like to thank Dr. Lalu and Dr. Pratheesh for inviting me to represent Pfizer Medical India for this conference, and really privileged to be a part of this esteemed panel. To give you an overview of what we do as medical affairs in Pfizer India is that we look at all kinds of need gaps from a patient's perspective. And we try to address those need gaps by multiple things, one of which is research. And the particular paper that I'm talking about is related to cancer-associated thrombosis. the prevalence data for cancer-associated thrombosis in India is very, what do I say? I would put it at the range is wide. So we don't know exact prevalence of the cancer-associated thrombosis. So we came together with CAHO. We planned a CAP survey, basically to understand what is the knowledge, attitude, and practices to treat cancer-associated thrombosis amongst hematologists and oncologists in India. So we carried out this CAP survey and we found something very interesting. We saw that a lot of HCPs were not using the standard guidelines. A lot of HCPs were confused about how to initiate and continue the treatment for long term. That actually led us to an important publication that we are currently also working on, is that we need a consensus document on cancer-associated thrombosis from an India perspective. So in partnership with CAHO, we had a Delphi consensus process where we designed the consensus questions, and we took a Delphi consensus process and we followed and we made a consensus document of it. While we published the findings of the CAP survey, which also Dr. Lalu knows, we won the first prize over at Mumbai Hematology Group. But the main outcome of this entire CAP survey exercise was that we were able to formulate a consensus document which is submitted to publication in the Indian Journal of Hematology and Blood Transfusion. And once this document comes out, it will basically be able to guide the hematologists and oncologists in India to initiate and continue therapy, basically address the need gaps of treating cancer-associated thrombosis in India. So data generation or publication is one part of it, and Professor Greenfield, he alluded upon it. He's also worked in the part of implementation science. The second part would be basically delivering this consensus statement to all the hospitals in India where it could be helpful to the practicing HCPs. And for that, again, I would like to mention that CAHO would be helping us to maximize the reach of this publication. So the entire process of generating the document and then disseminating the document, the medical affairs would definitely need an external partner. And CAHO has been a good partner with respect to this project for me, and they have been associated with Pfizer for multiple other projects as well in the therapy area of oncology as well as in migraine. To the second question that Dr. Pratheesh asked, what would be the role of pharma and academia? So at Pfizer, we have a purpose of changing patients' life and improving access to medicines. But looking at the medical affairs team in Pfizer, we have about 60 odd people. They are not enough to bring a positive impact on the patients in India. So we need a very good external partners. And one of the pillars that we saw today in the entire CAHOCON is trust. And trust is built basis the experience that we have had in the past. And that's the reason why trusted partners like CAHO would help us to make that dream possible of reaching and impacting patients' life in the future.
Thank you so much, Dr. Ketan. So, Dr. David, I would like to ask you, now you've heard us over the last 15 to 20 minutes, the various panel members about the various past initiatives of the past year of CAHO based on research on quality and safety. So we've heard about our journal, how we are proceeding. Then these are all areas of need which are identified on the patient-reported experience measures, then guidelines creation on reuse of single-use devices, then consensus guidelines on cancer-associated thrombosis. So this is a kind of a mix of, an example of what we are doing towards research and what we have tried to do over the last year. Now, with your experience, what would be your views on the direction we have taken, and how could we do better? How would you advise us on this?
Thank you. What I have heard you talk about has been much of what I said, I think, in my short talk to you. So I've heard your colleagues here speak about addressing problems that are relevant for them and their organisations, but also have a national relevance.
So it's got a local impact for your organisation, it has impact at a state level, and then as you're saying there about the prevalence at a national level. So it's picking significant problems that matter. It's demonstrating the relevance of the issues to other people. I think the efforts you're making to translate the knowledge to other parts through guidelines, through talks, through academic papers is excellent, and it's continuing that. The other things that's implicit that I've heard you say, or a little bit more explicit, has been creating the collaborations to undertake the research, the patient experience measures, the way you went about that study, involving the health professionals and the patients in that study, I think is an excellent example of doing really high quality and really rigorous, important research. And it's doing that, so what I hear you're doing collectively as well is creating a culture of research, a culture that is striving to take the knowledge from individual places, share it with one another through the conference, through the journal that you've established. So I think it's continuing to do that. The more you can create those networks, share that knowledge, draw others into your networks so that you're giving people clear, concrete examples of how to follow in the footsteps that you're taking. And it is, for me, it's simply repeating that process and supporting and helping each other through that. So you sustain each other and keep up your energy and resilience in doing that. So I think you're on the right track. It's continuing to do that. And as I say, supporting one another and taking the knowledge that you're developing and share it with the world. This is great doing it in India, absolutely fantastic. Take it internationally, make sure you're doing that. Publish it internationally, go to conferences, present it internationally as well. Your messages are really important.
Thank you so much, Dr. David, for your insight. So we come to the last question of this particular discussion. It's to Dr. Chinmay Shah, Chairman of our Research Committee. So, sir, now, if I would like you to do, either one is to tell the entire audience the key take-home messages from this panel discussion, and being the chairman of the research section, so what would be future initiatives and endeavors, and what would be, as we go forward, what should we be doing as part of the research team at CAHOCON?
First of all, thank you, Pratheesh, for a wonderful question, and I must thank all the panelists for their insights. So I think we have started with the keynote address by Dr. Greenfield, and he very well mentioned regarding impactful research and 6-pillar action of any research. So I think it is very important thing that whenever our clinical people are doing any research, it has a not 1, 2, 3 per total 6 effect, which has been mentioned by Greenfield very nicely. And then we have discussed regarding the journal, and the chief editor, Dr. Satish, very well mentioned regarding the hand-holding and support from the CAHO. So we invite all the people who are doing some research, who are doing a case study, who are doing a case report, that CAHO is here to support you, to handhold you. So please be there. We also need a pool of reviewers who are committed for the review. So we also encourage all the stakeholders, all the stalwarts who are sitting in the audience to be a part of our reviewer pool. Then sir has also mentioned regarding the research masterclass which we conducted to encourage the research and how to publish the article. Next we want to Dr. Rahul, and it is an excellent example of how any research can impact the policy. So as mentioned by Dr. Rahul, the PREM studies has been published by the CAHO, and it is really making an impact in the patient safety. And further, once we start using it, it is not far that it become a part of a policy. If we talk regarding single-use plastics, Shyam Kumar sir has very well mentioned that even a simple thing which you do is having a long-lasting impact. And sir is also again correlated with the citation of the articles. So similarly, as there is a use of citation, similarly there is a use of single-use instruments. So if we do it properly, it is going to have a long-term impact. Lastly, Dr. Ketan has mentioned regarding impactful research and KAP studies, and he has also given stress on industry academia collaboration. So let's come together. There are many faculties here who are from the industry and many are from the academics. So let's come together. And lastly, it was ended by Dr. Greenfield, and he has very well summarized bench to bedside and importance of such conference where we can share our views. As a chairman of research committee, I would like to have some thing to share with you under the guidance of Dr. Vinay sir, Dr. Lalu ma'am, and our Dr. Parag, that let's have CAHO research impact. And for that, CAHO is committed to handhold you, not only for writing, but also framing the research, for publication, for presentations. And we would like to have a different research masterclass throughout the year. We may have offline research masterclass as well as online research masterclass. So be there, be proactive, and please publish whatever you do. Thank you very much.
Thank you all for the panelists for your time, and thank you for this wonderful discussion.
A huge thank you to all our experts for your valuable insights and reminding us that meaningful research isn't always complex. It's simple, scalable, and truly what makes a difference when it matters the most.